slide in a little bit. Excuse me. So
Sorry.
in Lakota, that's okay. In Lakota, it would be check your aze. There's lots and lots of words. I think it'd be great if we created a poster with all the different words, indigenous words for breast. But these are some different changes that would really, and I've seen a lot of these in practice. A lot of women have come in with nipple discharge, fluid leaking out of one breast. It might look all of a sudden hot or inflamed. All of a sudden you've got a big vein coming up through the breast. You can have a sore. Something that's very concerning is all of a sudden the skin starts to dimple, or it looks like the peel of an orange. Maybe one nipple starts to pull in suddenly, or is inverted. You could have bumps or hardness, lumps, and change in the shape or the size of your breast, especially if it's unilateral or just on one side. So the breast tissue, the structure of the breast is definitely not just in the main part of the breast that we think of. It's the breast tissue goes all the way up into our armpits. The tissue is in your chest wall all the way up to your collarbone. It extends into our underarms, and a lot of the breast cancer, in the next slide I'll show you, is in that area. So for our transgendered males who still have breasts, it's important that they also undergo mammograms annually as well, because they can still develop breast cancer. Many women don't realize that they have breast tissue all the way up beyond the physical mass that we think of as breast. And the breast tissue covers a wide area of our chest. That means that breast cancer can affect any part of these areas. And radiologists working in Indian country have commented that women, Native women, tend to have more breast tissue on their sides or under their arm. I've actually seen women with third and fourth nipples under their armpits, and we're mammals. So that is not an uncommon thing. That's nothing wrong with your breast, that you just may have a third boob. And those tissues can also develop cancer. So just being aware of your own body and what your structure looks like. Here you can see that the location of most breast cancers, although the breast tissue is all over the chest wall, about 50% occur up in that upper area. So really making sure that you go all the way under your armpit and then into that upper quadrant, because 50% of breast cancers occur in that area. Breast cancer under the nipple is more common than most people realize. That's why it's really important to make sure that your clinical breast exam also includes into the nipple area and pushing deep into that area. Specimens for tumors and growths in the nipple area are usually sent away into laboratories that have specialized equipment to identify the cancer cells just below the nipple. So here's just another area, excuse me, another discussion of the breast. So you can also see that the lymph nodes, we have lymph nodes through our whole body. So when you get a cold or strep throat and you get sore tonsils and they go through your neck, those are lymph nodes. They are the filtration parts of our body. So they start up here, they go behind our neck, and then they come underneath our breast and underneath our armpits. And they filter out a lot of the bacteria and toxins in our body. And so when a woman gets breast cancer, those cancerous cells can often travel up into the lymph nodes. And that's what makes it really concerning and why early detection is so important. Most women are unfamiliar with these areas. And then you can see all the different parts. So, I think when we first see a woman breastfeeding, we think there's one little spot and that milk shoots out of that one center area. And in fact, we've got multiple glands and mammary lobes. And so it looks much more like a shower of milk than just one straight stream. And so you can see here in the picture that there's lots and lots of areas and milk ducts and fat cells that comprise our breast tissue. Here was a picture I found when I was putting this slide together too, that really demonstrates just different abnormalities of what breast cancer may look like. So starting from the top, you might just see a thick area, it might be firmer. The next one has a little dimple on it. Your nipple might be crusted or sore all of a sudden. And those sores just don't go away. They continue. So if you scratch yourself or you get an insect bite, don't panic too much. But if that nipple gets crusted and continues to just be irritated, definitely come in and have us take a look at it. It might be hot or red. Again, unexpected fluid coming out of the nipple. It's not uncommon for women who've breastfed to still have some milk leaking from their breasts for even some years after they have stopped nursing their child. But if it's red, if it's black, if it's brown, if it has an odor to it, if it's only on one side, those would definitely be much more concerning symptoms. Skin sores, again, like, you got a spider bite, but then that spider bite doesn't heal up, or it's irritated, definitely come in, have us take a look at it. We'll just go clockwise here. You get a hard lump, right? So like a seed that, nice, tell people like it feels like a pea or a marble. It's kind of stuck to the chest wall. It doesn't move. It doesn't change. It might get bigger, but it's not mobile. Those would be concerning. The orange peel is definitely a very concerning sign for breast cancer. A new shape, all of a sudden you grow a new part of the breast, or it's getting more big on one side, sunken, that nipple all of a sudden retracts in, the growing vein, and then a bump. So lots of different reasons to look about your breasts and to make sure that you're checking them just for self-awareness. We're going much more away from doing your breast cancer screening in your shower every month, but much more of
Yesterday I sat at your desk.
Sorry, what's that?
Yeah, it was.
Oh, sorry. Thank you. Yeah, so just breast awareness every day, every month, every year, knowing what your breasts look like, what they feel like, and so that if something does change, you know exactly what feels normal to you. There's lots of different types of breast cancer out there, and thus there's more treatments. So there's over 15 different types of breast cancer. Each type of cancer is different in the way it grows, and it spreads potentially different as well. That's why one reason why treatment and long-term outcomes for breast cancer will vary depending on the type of breast cancer. For example, some types of breast cancer that begin as an initial tumor or ductal in the duct of the breast usually grow about 7 years before it begins to spread, because those ducts, they hold milk, and so they kind of close in. So if we can catch those cancers early, there's a high chance that we can catch those before they spread. So impact of breast cancer on women: annually, about 126 per 100,000 women are diagnosed with breast cancer every year. 12% of women will be diagnosed at some point during their lifetime. And currently there's over 3 million women living in the United States with breast cancer. Here are some new updated statistics, and I was surprised when I had gotten these slides from Walking Forward. They had some statistics that were a little bit older from 2018, and their survival rate, even from 2018 to today, has increased. The survival rate for 5 years out for a woman with localized breast cancer is over 99% for the 5-year survival rate. So that's really high. And I think as we talk later, that people feel really anxious with getting screened for breast cancer. What if they find something? And so then that fear drives them away from getting screened. But we can see here that your rate of survival, if it's localized, and even if it's regional, okay, with regional and localized together, the survival rate is still like 97 to 98% together. So it's very, very high rate that women can survive this and go on to live really healthy lives. Here we can see that about 14% of all new cancer cases in the United States are female breast cancer. And then the highest is actually lung and bronchial cancer, as well as colorectal cancer for women. Those are the other two but you can see that it definitely comprises a lot of cancers for women. The median age of diagnosis is 63, but certainly we know women that have gotten diagnosed sooner and later in age. Here you can see the incidence per race. So fortunately, American Indian and Alaska Native women are at a lower rate of diagnosis for breast cancer. There's lots and lots of hypotheses to why this might be. Certainly some of it might have to do with genetics, lifestyle, diet. A lot of women breastfeed and have children earlier, which can be a protective effect for women. But let's see the next slide here. You can see that this is a little bit more parsed out, that through the different tribes and different regions of American Indians, your rate is different. So the purplish line is non-Hispanic whites. So in that same area, you can see comparatively what women in those regions, how their breast cancer rate compares. So certainly in the Pacific coast, where they're consuming a lot more fish and salmon and omega-3 fatty acids, they have a lower rate of breast cancer. And then in the northern plains and Alaska, especially Alaska, where vitamin D might be a little bit lower, as well as in the northern plains, because of lack of sun exposure, the rates of breast cancer are much higher. I loved these. The AmericanIndianCancer.org has really good informatics on breast cancer, and you can see here that 1 in 8 women will get breast cancer in her lifetime, and then certainly the increased risks. So we'll dive into these a little bit more. There's a lot of things we can't change. We can't change that we were born a female. Breast density, that's kind of mixed. And now with the advent of 3D mammograms, we can definitely get into the breast tissue a little bit better with screening mammograms. The radiologist can zoom in better, so you're less likely to get called back, which can increase anxiety. And getting older, we know that, like I said, your median age of diagnosis is 63, but diagnosis earlier leads to a better outcome. Native women have a 7% higher incidence of cancer rate in general than non-Hispanic women. But they also, of note, is that Native women have about a 10% higher death rate than non-Hispanic women. And that could be accounted for, rural, they may not access care, or their time of diagnosis may be later. So it's really important that we get the discussion out that mammograms do save lives, they do detect cancer much, much earlier, and that certainly the earlier we can get that diagnosis, the less likely it is to spread, and that we can be treated. So things we can do, obviously, are breastfeeding. Breastfeeding, we'll talk a little bit more about this as well, reduces your estrogen exposure, really reduces the woman's estrogen levels in her body. And so that can be a great protective benefit for women. Weight control, we really need to treat our bodies like we only have one only precious life. And so really doing everything we can do to burn off, because when we get that extra cupcake around our waist, that extra fat in the abdominal region tends to store a lot of female hormones, especially estrogen. So it's important that we continue to work on our weight, not just to feel fit, but to also just really be healthy and reduce our risks. Mammograms, exercising, limiting alcohol use, and regular breast exams. So screening guidelines. Here's the American Cancer Society screening guidelines. It's recommended that we start screening between the ages of 40 and 44, and that by the age of 45, you should have a mammogram every year until the age of 54. Women 55 and older can switch to mammograms every 2 years, or they can continue to have annual mammograms, and that really needs to be a discussion with your healthcare provider to make sure that your healthcare is tailored to you and your concerns and what meets your needs. And then we should continue exams The Honorary Woman program pays for mammograms up until age 64, but certainly we have women that are really living long and productive lives and may be at increased risk of breast cancer even beyond 64. So as long as you are expected to live another 10 years, as we see into the future, we should continue mammograms. That's for low risk women. And of course, we have high risk women. So if a first degree relative, a mother, a daughter, an aunt has breast cancer, we should start screening with mammograms 10 years prior to their diagnosis. So if your mother was diagnosed at age 44, then we would want to start screening you as her daughter at age 34. So women who are at high risk should, and then we can also incorporate breast MRIs, typically at age 30, or like I said, depending on the other risk factors. So if you have a lifetime risk of breast cancer that's 20 to 25% greater, certainly based on your family history, we can start screening sooner. If you have a known BRCA1 or 2 gene mutation, or if your first degree relative has one of those genetic mutations, then definitely we would want to screen you sooner. We do have the capabilities to do that genetic screening at Oyate. So if your first degree relative had breast cancer and had one of these gene mutations, it would definitely be worth your time to get screened for those as well, because the BRCA1 and 2 not only increase your risk of breast cancer, but also other hormone-driven cancers like ovarian cancers. So something to definitely know your family history, right? And then also if you had radiation therapy to the chest between the ages of 10 and 30, you should also start screening sooner. And that though we talk about breast MRIs, it really should not be used as a screening tool on itself. It should be used in addition to mammograms. So that's important to show. Excuse me. All right. I really wanted to add this because we don't talk a lot about alcohol and cancer. However, just like tobacco, alcohol can increase your risk of every type of cancer that we have, especially, excuse me, especially breast and colon cancer. Oh, let me go back. So the more you drink, the more you have a risk of developing breast cancer. I loved this hashtag drink less for your breast. If you pull it up, there's a lot of really good information about alcohol use in breast cancer. A big thing about the alcohol use is that, let me see if I can, about 14% of women, American women, drink moderately, which includes average of 3 to 7 drinks per week. Alcohol can interfere with the breakdown of estrogen, so the estrogen builds up in your body, thus increasing your production of estrogen. And then it makes the estrogen receptors in your breast actually more sensitive. So by increasing your estrogen receptors, the alcohol predisposes your breast cells to more hormones. The longer and the greater alcohol use in women produces more harmful effects, leading to the increased risk of breast cancer. So they've shown that just one extra drink or one drink a day increases your risk of breast cancer by about 14%. So here's just another infographic discussing all of the risk factors. Obviously, we can't change our life, like our age, our gender, our genetic risk factors. If a woman has gotten her moon time early, and we are seeing that more and more, and I'll talk about that in a second, that if our young women are getting their cycles before they're 12, that is increasing their risk of breast cancer later in life as well. And then late menopause, if you've gone through your change after 55, and that's basically, you know, once your body starts receiving that estrogen, the longer you have that exposure, the increased risk of breast cancer. So if you're using hormone replacement therapy, there is some mixed data on that, but mostly it's if you're using the estrogen with the progesterone in certain formulations. So sometimes we'll give just some topical estrogen or some low dose estrogen for hot flashes or for some vaginal dryness. But if you're using it cyclically with progesterone, that can increase your risk. There is some mixed evidence on birth control methods. However, your risk of breast cancer decreases once you stop using them. So talking to your medical provider about other options for birth control or using a progesterone only method can be very helpful. And then giving birth at an older age. If you have your first child after the age of 35, I know lots of women are delaying childbearing for a lot of reasons, and that's a good thing. That's, if they're not ready to have a child, I don't want you to force yourself to have a child just for breast cancer prevention. But then going back to your pre-pregnancy weight, breastfeeding, all of those things can be very controllable. So, all right, so there is another discussion about think pink, live green. And as relatives to the earth, I think it's important that we discuss that not only what you put in your body, but you surround your body with has a huge impact on your risk factors for breast cancer. So every time you eat and drink products, you have an opportunity to make healthy changes for not only yourself, but for your breast health, sticking to a healthier weight, getting regular exercise, limiting alcohol use. We talked about those. And let me just read through some of these other things. So getting fresh air. So let me see here. Avoiding unnecessary radiation, getting enough vitamin D. You could see in those earlier slides that women who live in the northern plains or as well as Alaska who are not getting as much vitamin D via sun exposure are definitely at an increased risk. Some studies show that a possible link between low vitamin D and a higher risk of breast cancer. So that's important that if you're, of course, also hand in hand, if you're inside all the time, having sedentary lifestyle, working inside, using the computer, watching TV, you're not outside exercising as much as well. So that's something to discuss. And then women who are stressed and sleep deprived can also be at an increased risk because then our cortisol levels are increased. So cortisol is a stress hormone, and stress hormones make us hold on to that fat because they think we're in a time of stress. So ongoing stress and sleep deprivation definitely increase your risk of breast cancer. It leads to more cortisol, and that's a negative impact on our immune system and our body's ability to repair itself. So cancer is basically a cell that doesn't turn off. It just keeps growing and growing. And so if we have more stress hormones in our body, those cells just don't regulate as well. We need quality sleep to function well and keep our immune system strong, as well as repair and heal the wear and tear of everyday living. So making sure that you're turning your screens off at night, you're doing your meditation or whatever you need to do to decompress at the end of the day. And some studies show that a possible connection between extra light at night may be also linked to a higher risk of breast cancer. So melatonin, which is that dark, it's activated in our brains by darkness, also helps promote normal cellular growth and reproduction. The other thing I wanted to mention is our plastics. We get our Tupperware and our Touchables, and really making sure that we are using healthy plastics, because those plastics can actually get into our breast. The BPA products, which I believe is number 3 level plastic, the BPA actually goes into the breast, and they've actually done studies that shown that breast milk contains some of these plastics. So what we eat our food out of actually goes into our breast milk, and then those chemicals go into our babies. So really making sure that you're using plastics that are healthier. So 1, 2, 4, and 5, and not just don't reuse your margarine containers, those kind of things. Treat yourself, right? Treat yourself to glass or things that are much healthier to use, and try not to heat up our food, reheat it in the microwave. in glass containers instead, so that that plastic isn't leaching into our foods. So think pink for a cause. This was just another really great informatic about breastfeeding. Breastfeeding has such a huge, important impact on our bodies. It's the first sovereign food for Indigenous people that our body has made perfectly for our babies. So not only are babies getting the perfect nutrients, the proteins, the amino acids, but they are also protected from a lot of childhood cancers. And for every 12 months that a mom breastfeeds, her rate of breast cancer decreases 4.3%. So it's very, very, very helpful that women breastfeed. Lactation also slows down when a woman will start having her menses again. And so that also decreases our estrogen exposure. All right, let's see here, what else? Certainly it's recommended that women breastfeed for the first 6 months of a child's life and then introduce solid foods after 6 months. But really, if a woman can breastfeed during those first 6 months, she's gonna have a huge benefit, not only on herself, but her baby's health. So next thing I want to talk about is ceremony of self-care. How do we as women take care of yourself? So we just talked about drinking clean water, whole food, fresh air, putting good things into our bodies, and then cleansing our lives due to undue stress, pollutants, and toxins. We just talked that a lot of those chemicals that we're even eating our foods out of, styrofoam and reusable plastics, can put toxins into our body that have been shown to act as estrogens or hormones. Same thing with meats. If you're eating meats, making sure that you try to get organic meat or organic buffalo, so that those animals were raised by not putting extra hormones in. Part of the hypothesis that women have been starting their moon times earlier is that the meat we eat has been so polluted with additional hormones, so that those cows are bigger, those chickens are bigger, those eggs are bigger, and yet those hormones and those antibiotics go to us. And so those toxins also go into us, and they're affecting the way that our bodies see hormones. Living a better life to take care of Unchi Maka, right? So not only are we taking care of ourselves, but when we're doing good things for ourselves, buying organic foods if we can, reducing our plastics, drinking clean water, eating whole food, that's also going to be better for our earth. And then we're going to receive less toxins in general, which is going to be a great thing for our breast health, as well as for the breast health of our children and our grandchildren for time to come. Definitely consider using green cleaners in your household as well, so that you're not exposing yourself to as many toxins. Some toxins like Roundup and some of the weed eaters that we use in our fields and in our gardens and in our grass also have been shown to be carcinogenic or cancer causing. And then taking care of yourself. So I think it's great that you designate 1 month. Maybe it's your birthday month. Maybe it's your mom's birthday month, to really honor yourself and honor your health. And it's much easier if we remember that month, circle your days, put a star on the calendar, and make that month about you. And really making sure that you're getting your optometry, getting your mammogram, getting your pap smear, doing all your healthcare visits in that month. Take a day off from work to get all of those things done, so that you just remember to do it. I think it's hard for us as mothers who are busy, we're coordinating everybody else's schedules to coordinate our own. So really making sure that you take that time to celebrate yourself, go get a pedicure afterwards, or go take yourself to a cup of coffee, do it with a friend, take her along with you, and that's your girls' day out of really taking care of yourself and developing a relationship with a clinician. So I think it's important that you feel comfortable with a partner in health, and that you find somebody that you can ask questions of that you want to seek answers, right? So even when we go into ceremony, traditionally, we often go there to pray, to seek answers, to receive guidance, to receive healing. And we should really think of our own clinical visits, our mammograms, our pap smears, our time with our providers as a ceremony for yourself. Really go there to seek answers. Don't take everything at face value. If you don't understand something, ask for understanding, ask more questions, and create a relationship with somebody you feel safe with. And listening to your body. I've had so many women come in through the years I've been a midwife with just an uncertain ache, or their moon times have changed, or they felt a lump, or they just didn't feel right. And they pushed for answers. And I pushed for them to get, it's like puzzle pieces. And we really got to put those puzzle pieces together. But the more you know your own body, the more pieces you're going to come to the table with. So listening to your body and making sure that your healthcare provider also listens to you. I loved Honor Every Woman program. They have a wonderful discussion of all the parts of our own health, to making sure that we're resilient, that we're asking for support from our family members. When you go to your appointment, wear something comfortable. Don't wear a lot of perfume or lotions or antiperspirants, especially when you get your mammogram. And try not to schedule your appointment around your menstrual cycle, just because your breasts are more tender. They may be more lumpy. And so you may just feel more uncomfortable during that time. Ask questions and write them down. Like, carry yourself a little journal and write things down. I'm always writing things down for my patients so that they can take those home and look them up as well. Because what I tell you in a 20-minute visit you may have more and more questions, and I want you to be able to come back and ask more of those questions. So definitely look up good research. And if you see something on Facebook, check it with another website or a source, so that you're making sure that you're getting really good, accurate information. I think a lot of us are scared of the unknown, scared of what might happen, and being afraid. So mentally we block out self-care, because if you just ignore it, it can't be there, but it's still going to be there. So not being embarrassed, knowing that the screening can save your life, and trying to stay positive. Dawn or Kelly, did you guys want to say anything about this slide or the Honor Every Woman program?
I don't have necessarily anything to say about the slide, but if anybody is interested in learning more about the Honor Every Woman program, you're welcome to go to the Great Plains Tribal Leaders Health Board website and find us in the programs tab. And then also you're always more than welcome to reach out to any of us. And Mandy, you can certainly put anybody in touch with us if they need our services.
One thing I wanted to add to that is that I really love the Honor Every Woman program, because it really provides a bridge for coverage. I think a lot of us who may not have health insurance, or you are tired or worried about jumping through the hoops of contract health, if you have an abnormal mammogram or an abnormal pap smear, that the Honor Every Woman program not only provides money for screening, but then it provides money for follow-up. So if you have an abnormal mammogram or an abnormal pap smear and you need further diagnostics, maybe you need a needle biopsy at Dakota Radiology or colposcopy, we can get those things done. And the Honor Every Woman program is, Julie's our patient navigator, and she's going to walk with you through that. So I'm going to walk with you up until the diagnosis, and I'm going to continue that journey. And then Julie and the Honor Every Woman program, they're just going to be like another shawl around your shoulders, kind of guiding you so that you don't feel alone and you don't need to worry about payment for these things. Because I think we worry a lot, that's money that might pay for food or our rent, and maybe contract health isn't going to pay for it. But if you're eligible for the program, it's just like a huge bonus. I love it because I can just send people to Dakota Radiology. They can get their needle biopsy done. they can have a second opinion, and it's done. And you don't have to worry about it. And we don't have to wait for contract health also, or purchased referred care, to make those follow-up appointments. So it really does expedite the screening and diagnostic process.
Amanda, I
yeah.
do just want to add just a tad bit onto that also with our with our subaward, with OHC being one of our subawardees, as well as the Native Women's Healthcare, which is on the Susan campus. Currently, they both have received a grant from us that we get through the CDC, that they're also able to help with transportation. So when a woman comes and gets her mammogram, she at the end of her mammogram, she will also get a is it 33?
It's something.
Somewhere
I think
around
it's
there,
$25 or $30 gas card. Yep,
Yep.
it's a gas voucher.
Yep. So she'll get a gas voucher to help offset some of the what it costs her for transportation. So if you know anybody in the community, send them on over to Yetsenia, who's in the and Amanda. Amanda takes care of the our cervical cancer screenings, and then Yetsenia takes care of the breast cancer screenings.
Right. And we also have drivers at Oyate. So if you can't make it or you don't have a car, we can still line up transportation for you. It's like our own private Uber system at Oyate. So they can come pick you up and take you to your appointment, and we can still give you the gas voucher, because that's something that your family can use as well. We want to make sure that your family and you are taken care of during these screening, and that you have help to be able to get to those appointments. Same thing if you need to have a follow-up, a biopsy or a repeat mammogram, or maybe a diagnostic ultrasound, we can offer gas vouchers and cards for those as well. All right, so effects of historical trauma. In a lot of the breast cancer discussions and panels I've been a part of, I've never really heard of a lot of people touching on this. And I think it's really important for our population and for all women to realize that victims of emotional abuse and physical trauma, or intimate partner violence, or maybe PTSD in their history, can affect their ability to get screened. And so studies have shown that victims of emotional abuse and victims of physical or sexual abuse, ages 40 to 74, had an 87% decreased odd of being up to date in their pap smear, and an 84% decreased odd of being up to date in mammogram. So going back to that ceremony of self-care, it's hard when we are in the cycle of violence or cycle of survival to take care of yourself. And so it's really important for us as healthcare providers to be able to develop personal relationships with each one of our clients and engaging them to be able to make sure that they have a safe place to get screened, and that we capture as much of that screening as possible on a single visit. I never like to have somebody come back for another visit if we can do it that day. So among women aged 40 to and older, those who had reported sexual or physical abuse had a lower breast cancer screening rate and cervical cancer screening rate. And you can see that with sexual abuse, or you can see the rates. So only 15% of women who had had some form of abuse in their lifetime had been up to date on their breast cancer, whereas people who had not had that trauma had 53%. So it's very, very, very important that physical and sexual abuse have a huge bearing on women's chances of getting screened. And so that when women do bring those things up in our clinics, that we support them and make sure that we can try and support their healing journey, not only emotionally, but also physically, so that we can get them into screening faster. So it's well documented that women who've experienced severe intimate partner violence are at an increased risk of physical and mental health problems as well. So they may be coming in for another complaint. Maybe they have a knee pain or they have something, a hand injury, but they are not up to date on any of their screens. So capture them in on those visits and really try and build a rapport. I've had a couple of patients who may say, well, I'm not really ready today, but I'll make a follow-up appointment. And so developing that dialogue with your clients and making it a lifelong relationship, not just a one-time visit, I think is really, really important. So the demands, these demands based on the physical and mental health problems increase acute and chronic care management of these women and make preventative screens less of a priority. So at Oyate, we have such wonderful teams, and if Jeannie or Tess is seeing a patient for a knee pain or diabetes, they'll link her in to see me, try and do it the same day. And I know Yetsenia in the mammogram department is also great at capturing women when they come in. So you can come in, you can get your pap smear done, you can get your diabetes taken care of, and you can get your mammogram all in the same day. And then you can get back to your family because we all have lots of things to do. So also women who've experienced severe abuse may be less likely to make appointments to receive preventative care because of the control of their abusive partner. So taking the opportunity for women when we have them to make sure that they are available. All right. Hang on here. There we go. Just another infographic that mammograms really do save lives. That 100 out of 1,000 women may have to return. So if you get return, phone call, say, hey, we found something on your mammogram. We need to do an ultrasound. We all flurry into a panic and get nervous. And out of those 1,000 women, 61 will need additional imaging, but find nothing wrong. 19 of those 1,000 might need a minimally invasive needle biopsy. And out of that, only 5 out of the 1,000 will be diagnosed with breast cancer. So I think it's really important that we find that even if we're calling you back or telling you that we found something suspicious or concerning, to not put that off, because the rate of being diagnosed with breast cancer is still very, very low, but oftentimes having those needle biopsies or those additional imaging can detect problems before they become severely cancerous. So things to think about as well when you're coming in, if you're concerned or you're anxious. I think women, we all have anxiety about something being wrong. Who's going to take care of my kids? Who's going to pay the bills? And so really going back to that ceremony of self-care, dress in something that's comfortable, try and wear 2 pieces so you don't have to take off your whole outfit to put the gown on for the mammogram. The women that do our mammograms are all women. They're very, very sensitive. They're very warm. And I think it's important to feel comfortable with them. If you don't feel comfortable that day, ask to get rescheduled, or if you're just not feeling take a minute. Don't be afraid to feel that you feel rushed through your appointment. If you just need to have a moment to pray and smudge yourself off or take some deep breathing. If you have AirPods, bring them with you, plug yourself in and just listen to your own music so that you can kind of drown out the concerns. Certainly part of our grant through Honor Every Woman is we're going to be incorporating some essential oils into our procedures. And I've used these before in Pine Ridge through my colposcopies, or if a woman has had a bad experience, sometimes even just the smell of the mammogram or the ultrasound gel or the pap smear, the hospital itself can be triggering. And so using an essential oil like lavender and sandalwood or our own traditional medicine of cedar can be very helpful in reducing those anxieties and allowing a woman to concentrate on something else than the medical smells and surroundings that she's in. I just had my own mammogram last month, my first mammogram. I'm 40 now. And I found that stretching was very helpful because you're like going all the way up and sticking your boob in the air. So do some stretching, warm up. If you wake up and you're stiff from some arthritis, do some gentle stretching before you go, do some breathing, go for a little walk. Treat yourself that day. This is your day to take care of yourself. Do some yoga, put on a DVD or a YouTube video of some yoga to just ground yourself and know that this is your body. This is your one and only life. And the more self-care you do for it, the better of an experience you're going to have. So thank you so much. That's my little girl breastfeeding many years ago. So I just want to thank you all for your participation today. Certainly, I think Kelly had a couple comments and some goodies to give out. So I'll leave it at that. Any questions?
Amanda, I just want to say thank you so much for that presentation. I really, really appreciate the cultural aspect that you brought forth on how to kind of treat your body like a ceremony. I really,
Yeah.
I mean,
Thank you.
that's like, it's really touching, because I know a lot of our Indigenous women, because of the historical trauma and things like that, and the PTSD, don't always feel comfortable with invasive type procedures such as a pap smear or a mammogram. And so I appreciate you touching on that aspect of it.
Thanks.
Does anybody have any questions? We're about a minute over our time, but I think that if everybody else is okay with it, we can give a couple more minutes just to, if anybody has any questions for Amanda before we sign off.
I just want to say this is one of the best presentations I've seen and heard. So thank you very much.
Thank you.
Also, I just wanted to remind everybody that we will be offering evaluation. I posted it in the chat. If you guys want to take just a couple minutes, probably not even a minute, to fill out that evaluation. And then if you fill out the evaluation, your name will go into a drawing. We have some beautiful Honor Every Woman t-shirts that we're quite proud of. So we'd like to give one of those away. If you fill out the evaluation, your name will go into a drawing for to win one of those t-shirts. Also, next week on Monday, the 18th, we will be doing another webinar, and in that webinar, we'll be featuring our very own Dr. Mary Milroy. She's going to be giving us a presentation on that day, and it'll be 10 o'clock Mountain Time. And I do believe I've already sent out an invitation, but I will be sending out a reminder probably tomorrow and then again on Monday. Does anybody from the Honor Every Woman team have any final thoughts, final questions?
I just wanted to add my thanks and appreciation to Amanda for this wonderful presentation, especially the cultural component to it. So thank you so much. And I want to thank everybody. I want to thank everybody else for joining us on this Zoom call. And I encourage you to check out our Facebook post. We'll be posting different informatics, infographics, and flyers to our Facebook page. We encourage you to wear pink on Fridays in honor of I will say Breast Health Month. And if you post a selfie of yourself in pink, that's another way you can go into a drawing for one of our t-shirts. So we would appreciate your participation, and we appreciate it. Appreciate you being here today.
Have a good day, everybody.
Thank
Thank you.
Bye.